So hello everybody, my name is Lisa Pleyer. I'm a full professor of hematology in Salzburg, Austria. And my talk this year at ASH was about using advanced techniques, including machine learning techniques, to be able to find out whether bone marrow evaluations are still relevant for patients in the year 2025. So we have a huge database of more than 4,000 patients that is extremely well documented and of very high granularity. And we have also received data from 2 phase 3 clinical trials. So we not only have a real-world part in our database, but also a randomized phase 3 part in our database. And of these 3,000 patients that had the diagnosis MDS, CMML, and AML, we took these and looked at that data very closely. So we have a lot of data on these patients, more than 200,000 data points, including a lot of differential blood counts and other things that are available that are not from the bone marrow. And why did we perform these analyses? Because we and others have also published that in the real world, patients only receive bone marrow evaluations in about 50% of the times during the follow-up in their treatments. So bone marrow evaluations are a very painful procedure, and it takes about 2 weeks to receive the results, usually, at least the histology results. And that is why we feel it is so important to be able to define a different type of response that is not based on such painful procedures that also take a long time. And also because it's not happening in the real world. So we first looked at the clinical trial data, and we saw that even in a phase 3 clinical trial, only 66% of patients are having bone marrow evaluations. So at the moment, all of the response criteria, they focus on the bone marrow. And if a patient doesn't have a bone marrow evaluation, they are automatically plonked into the no response group. But since this is not happening in the real world, we feel it is really important to find alternative response types, as I said, that do not necessitate a bone marrow evaluation. And we put all these 200,000 data points from these 3,000 patients into a very complex AI model. And with all of these rich data sets, we then looked at first the whole cohort and then at subgroups defined by diseases. So we looked at the AML patients separately, the MDS patients separately, and the non-MDS, non-AML patients separately. And then we also looked via first-line treatment groups, so patients treated with HMA-based therapies or with chemotherapy-based therapies or with other therapies. And basically, to make a long story short, in all of these subsets and also in the whole cohort, we saw that in the context of rich peripheral blood data, the bone marrow evaluations, the information related thereto was not necessary in the outcome prediction. So that's what these complex AI models showed us. Basically, we destroyed the information content of all the bone marrow-related variables. And after destroying this, we wanted to see, did the accuracy of these methods of the prediction go down, and it didn't. So what does this mean? To summarize in one sentence, it shows us that bone marrow evaluations are not as important as we thought they were in the context of rich peripheral blood data. And that's where we're going to work from. We're going to try to identify which parameters are the most important, which cutoff values thereof, to ideally be able to identify a response type that is fully capable of distinguishing patients with different prognosis trajectories without necessitating a bone marrow evaluation. So basically that's what we're working on. And I feel it's important that we not only have the real-world data set, but also the phase 3 randomized clinical trial data set where we validated the results. So I think that is very good in confirming what we have been working on so far. And thank you for your attention.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference. and we're deeply grateful for your support.